Bismillah ar-Rahman ar-Rahim. From the last almost 1 week, more than 1 week, you all people are listening, hearing a new disease that is called the monkeypox. And how many cases have been reported, confirmed cases it is more than 100 people. The important case was reported in the UK on the 4th May, and today is 25th May, almost 21 days. So that is why how many cases up till now? These is almost more than 100 cases have been confirmed. We discussed in our last previous videos that Monkeypox belongs to the smallpox virus, and almost similar but less aggressive and less serious disease appear due to this virus, Monkeypox virus. This Monkeypox virus was reported first in the animals in 1958, and then it was reported in humans in 1970 almost. And almost so many cases were reported previous years in endemic areas, but not in the endemic areas. This time, this disease is appearing in non-endemic areas like UKs and Europe and other countries. So that is why the WHO is taking so many measures, early measures, because the corona has taught us so many things. That's why the healthcare systems, governments, and the WHO is conscious. Whenever any cases like this disease or other diseases appear, so they start taking measures to save the life of the peoples. We'll today discuss how to diagnose the case of the monkeypox. Up till now, the NIH has reported that no a single case is in Pakistan. The last 2 days, we were reading some social medias, the suspected cases, but confirmed cases by PCR. No such cases present in Pakistan. Anyhow, the government has warned the people, because now the world is a global village. If any disease appears in UK or in America and in Canada, can spread everywhere. So we'll discuss different methodologies, ways of transmissions, and how to manage this case. This is not only important for the people who are listening, who are watching my videos, but also very important for the laboratories to diagnose the cases and how to separate the suspected cases and the non-suspected cases. This is the beautiful view of the Azad Jammu and Kashmir Medical College in a beautiful city of the AJK, that is the Muzaffarabad, among the beautiful mountains and the clouds hovering over these mountains. This is the evening of this day, and you can see the beautiful mountains all over behind me. This is the heaven on the earth. This is the table showing the actual confirmed cases in the non-endemic areas. In the Europe, especially more cases are present in Portugal, Spain, and United Kingdom. About more than 30 cases, and around about 20 cases are suspected and will be confirmed. This is up to This is the report of the 21st May 2020. So this is very alarming, and this is the case of the endemic areas. This virus is divided into two types of the virus. One is the Central African Republic virus, and other is the West African virus. The West African virus is more dangerous. The mortality is up to 10% as compared to the Central African virus of the Nigerian virus. It's about 3 to 6%. The mortality, the disease is almost similar to the smallpox, but less severe and less dangerous, and as compared to the smallpox. But the overall mortality depends upon the age of the patient, the type of the virus, the load of the viruses, and the immunity of the virus. So, very simple, the transmission, the case was reported 1958 first in the animals, especially maybe in the monkey. That is why it is called the Monkeypox. However, can be present in the rodents and squirrels and the rats, even in the other animals. So this is basically a zoonotic disease that can be spread to the humans due to some scratch, bites, or due to taking of the consumption of the foods, meats of the animal origins. And then from human due to physical contacts, due to droplet infection, similar to the coronavirus, we have already noted that this may be. The symptoms are all divided into two parts. One, the symptoms are called acute phase, and then the second phase is called the eruptive phase. The symptoms appear after 5 days, and the prodromal period is up to 21 days, maybe 4 weeks. First of all, the patient feels the fever, high grade, could be high grade fever, could be with the shivering, and then there is the headache. And very important is that there is the swelling of the lymph nodes. This is the differential point from the smallpox, from the other diseases, drug allergies, and syphilis, and so many other skin diseases, which are mimicking with this smallpox and mimicking with this monkeypox. So you can see the in patients with these symptoms, and thus enlargement of the lymph node may be painful sometimes. There is tiredness, exhaustion, backache, and after some time, then there is the prodromal phase. This prodromal phase, again the rash, and then the macule, then the papule, then vesicle, then the pustules may be filled with the pus and something. The illness may be continued 3 to 4 weeks until unless there is treatment and regression of this. So these are the very classical vesicles, and this after that sometimes the starts drying. This is the regression phase, so around about after 2 weeks. Then this is the this can regress to the scales and the scabs, and but the symptom, the signs may remain for hours, or we cannot say, because we have seen in the smallpox signs for a long time. So how to diagnose? That is very important. First of all, to differential diagnosis. Why to diagnose? First of all, is the to make the differential diagnosis. Either it is a monkeypox or it is other diseases like smallpox, chickenpox, measles, bacterial infections, scabies, syphilis, and drug allergies. Almost start is similar. The very important thing is that the patients may suffer with this due to upper respiratory tract infection, and that they spread with the coughing, sneezing, talking, uh, making a hand, shaking hand with each other, and the physical contacts and the sexual contact. Especially these all cases are being appeared in the homosexual patients. And the important thing is to make the differential diagnosis, history, clinical presentation, and the lymphadenopathy is very, very important in this disease as compared, which is not present. Another thing is that to get the positive reports, the collection of sample is very important. Samples collection should be appropriate, and the transportation from the patient to the lab is very important for the diagnosis of this disease. If you are not taking the sample from the appropriate site, or if you have taken the sample from appropriate site and are not sending in the safely transported method to the laboratories, then the question of positivity or its false positivity or false negativity may be there. So for the confirmation of this monkeypox depends on the type of the sample and the quantity or quality of the sample and the method of the laboratory that you are using for the diagnosis of this one. Another thing is that the specimen should be packed and shipped in accordance with the national and international criteria the WHO has described detail. When the sample is in the laboratory and after taking so many measures, in the diagnosis is only done by the PCR, qualitative or quantitative PCR. So to get the proper report, the sample should be collected from the roof of the vesicle, from the fluid of the vesicle, from the pustule of the vesicle, or from the scales and test. You can take the biopsy, but in the biopsy, you should not use the transport media. Should be collected in a dry and sterile tube and sent to the laboratories to get the PCR. PCR from the blood, PCR from the saliva, PCR from the anal secretions, or from the semen are usually inconclusive, because especially in the blood, the viremia is very short duration. That's why you cannot get any proper report from this PCR. So if you are taking the sample from the blood and there is no sign and symptom, the clinical symptoms are very important when you are collecting the sample from the blood before appearing of the eruptive phase. There are so many other things. If the patients that he take the history of the patient, if the patient has already taken the vaccine of the smallpox, if the patient has taken VIG immunoglobulin for the this orthopox virus, laboratory personals, you can get the negative reports or false positive reports. So you should be aware. That is why the history is important to the test, the date of the fever, the date of the onset of the rash, the date of specimen of the collection of the sample, and stage that I have to adaptive phase, that is the macule, papule, vesicle, pustule, and the crust. So this was about the diagnosis. The only important thing is the PCR antigen antibody method. The serological methods are inconclusive, that you should not rely on these methods. Only and only that is the vaccine. The companies are sending, and the companies are misleading the people that you should get the diagnosis from the antigen and antibody test and serological test. But the WHO and CDC has not recommended any of this test. So only FDA approved test is the PCR. So another thing is the prevention depends upon the we divide the prevention into two processes. One is the vaccination, you can prevent, and other is the general public awareness and the health caring bodies awareness. Important vaccination, this was being used for the smallpox, but you all people know that the smallpox was almost completely eradicated into 1970, and after 1980, the use of this vaccine was almost decreased. That is why this monkeypox is reappearing. So this vaccine, genius vaccine, is also known immunomune or Immunex. This is the name of the vaccine that is being used for the smallpox, and they are considering this is 85% effective against this monkeypox. But there's I think this may be effective to stop to reduce the symptoms and to reduce the complications of this disease. So that is why this is being used in this upper arm. And when we were children, I was in class 6, and I was inoculated the smallpox vaccine. This is attenuated living virus, a live virus, and there are 2 doses, and can be used for children of the 18 children and 18 plus, and 2 doses about after the 4 weeks. And the immunity production is only considered after the completion of 2 doses, and antibody against this virus you can detect are effective for the after 4 weeks. But still the people's first primary vaccine, they are trying. Still newer vaccine is based on modified attenuated vaccine virus. It is called encrustines. It was approved for the prevention of the monkeypox in 2019. It is also of 2 doses, the same duration, 4 weeks. Smallpox and monkeypox vaccines are developed in formulation based on the vaccinia virus due to the cross protection of it. So you can, one thing you can, who can get this vaccine prophylactically, and even the patient's diseased patient, you can give this vaccine to reduce the sign and symptom. This is how this is being used with a small probe and on the upper arm. Second thing was how to that was to awareness of the public health measures. Raising the awareness is very important. Raising the is very important. That is very important thing to raising awareness, risk factors, educating people about the measures they can take to reduce the exposure to the virus and the main prevention strategy for the monkeypox. And also the policies offered vaccine to persons who may at the risk, like laboratory people, doctors, and healthcare workers. This is very important thing is that. Another thing is the government's role. What should be the risk factors should reduce Surveillance and the rapid identification of the new cases is very critical for the outbreak containers. During human monkeypox outbreak, close contact infections person is the most significant risk factors. Healthcare and the house members are, all are on the risk. So that is why one thing is to reduce the factors and identify the factors which are responsible for the transmission. Another thing is the reducing the risk of human to human transmission and the risk of uh, animals to the human transfer. So this is very important that you should know what are the different transmissions way and to reduce these things. These were the different important things. The treatment of this patient, this disease is available. One of the drug that is antiviral drug that is called tecovirimat, and other is the two drugs. They are called cidofovir and brincidofovir. The brincidofovir, about the data is also available, and the data about the tecovirimat is available. These both drugs are recommended now and recommended, and they have very effective role in controlling the aggressiveness of the patient. They are used to the exposed patient. This was all about the different information of the diagnosis, how to stop this disease and how to treat the patients suffering from this disease. Thank you very much. Hopefully this video will be very helpful for the laboratory peoples and for the peoples who are hearing about this disease, the monkeypox. The summary is this is a self-limiting disease. This may be dangerous in the people who are suffering from any autoimmune disease or there's some immune problem. Thank you very much. May Allah give us a remedy. Ismahu Tawaun Zikrahu Shafaun.